Hey everyone, it's Emma with today's updates about the coronavirus. Today is Thursday, March 5th, and I'm going to talk to you about some of the latest updates and developments that have happened in the last 24 hours. I've made a roundup article with some of the latest news in there, all the stuff that I've sifted through for you to look through so you don't have to go through all of the headlines everywhere. Since that was published, of course, there's been some other big updates too. So I have a couple of things that I want to talk to you about before I get into that article. First, I wanted to draw your attention to this map that I've been using for a while, and I'm seeing a lot more people use it and talk about it now, but in case you haven't seen it, you should definitely take a look at it quick. It's put together by Johns Hopkins using the data that is, says down here at the bottom, the data from the WHO and the CDC, and over here on the side, it tells us about the total confirmed cases, and it breaks it down to where each of those are. Total deaths are over here, and total recovered is over here. On this map, you can zoom in, and you can drag around and go take a look at whatever you want to see. And each of these red circles indicates where there is at least one case, and you can click on it and it'll give you a little bit more information. Sometimes this lags a little bit. Sometimes when they update it, the numbers actually, some things disappear, but then I believe they end up coming back. But again, just to remind you about all of this data and all of these numbers, we can only see confirmed cases if people are tested, and there's still a big lag in, especially in the United States, who is being tested or not, whereas in some other places like South Korea, they have the free drive-through testing. People don't even have to get out of their cars, so obviously the data coming out of a country who is testing like that is going to be a bit different than countries that are struggling to get people tested like the United States. This data is also, it's not consistent in the way that it's reported and the way that it's tracked among different, probably localities within countries and between different countries. There's a possibility that some countries are not releasing all of their numbers. This map is interesting and it's useful, but, you know, the numbers are probably not completely accurate for various reasons. One of the most interesting updates that I've seen since I put the article together, the Director General of the World Health Organization is saying that the coronavirus epidemic is not yet at pandemic level, but there are very concerning signs. But at the same time, if you see in this article here, that very same person from WHO was quoted in Geneva today on Thursday as saying, "This is not a drill. This is not the time for giving up. This is not a time for excuses. This is a time for pulling out all the stops." He added that countries have been planning for scenarios like this for decades. Now is the time to act on those plans. So those two things that are being communicated sound a little bit different to me. And we're seeing that across the board. Conflicting information, conflicting tones, conflicting levels of urgency. It really does kind of leave it up to us to decide what we want to do with this information and how concerned you really want to be. Also, the Dow has tanked nearly 1,000 points today, despite some of those gains that it made on Wednesday. Some people are not concerned about getting the virus themselves. They think they'll be fine, but stock markets are tanking. Supply chains are getting interrupted, and obviously if you end up in a quarantine that lasts a month, you are going to be affected by this, even if you don't actually catch the virus. There are things worth being concerned about and things worth preparing for here too. But over to that article. We started this yesterday, if you saw my last video on, that was March 4th on Wednesday, where we updated you on some of the news from Monday and Tuesday. So these are 5 areas of information that I think are important for everybody to know about from about the last 24 hours. So I'll just go through this with you. If you want to find this article on The Mind Unleashed, everything in here is linked, so you can go and check out the sources where all of this stuff came from, read more about it, and decide what you want to think about it and how you want to react to it. A Yale professor is warning of an explosion of cases. There is absolutely going to be an explosion in the number of identified cases, but how fast that number increases is highly dependent on how fast we can test. He also says that the testing in the United States and the efforts that the United States has done thus far have been woefully inadequate. This is something we talked about in the last video, and probably something that most people have seen in the headlines, that tests are have been hard to come by in the United States. The CDC has changed their recommendations on who can be tested and made it easier to test, but it looks like not all states in the United States are heeding that information, and it's still difficult for some people to get tested. There's also still a lack of tests. King County, Washington, which is the county that Seattle is in, has encouraged its 2.2 million residents to stay home for the next 3 weeks. King County is also suggesting that anyone over the age of 60 stay indoors and that people attempt to telecommute rather than physically going into their work. And this next part is a little bit amusing. I've seen some headlines that just say King County is warning its residents to not lick their ballots, but they're referring to the mail-in ballots. If you live in King County or probably anywhere in the country at this point and you are submitting a mail-in ballot for the upcoming March 10th primary, probably don't lick the envelope for your ballot. A county in California has declared a local health emergency after reporting a second confirmed case of the virus. The newest case was traced to a Grand Princess cruise ship that had departed from San Francisco in mid-February. The patient had been reported to be critically ill earlier yesterday, but it was later confirmed that that elderly passenger passed away. That death brought the U.S. official count to 11. The Grand Princess cruise ship is expected to arrive off the coast of San Francisco on Thursday, as the CDC is investigating the small cluster of coronavirus cases that are associated with its previous voyage. California's governor said in a Wednesday press conference that the ship will be held off coast and not allowed to dock. Los Angeles County, California also declared a state of emergency as they had 6 new cases of the virus confirmed on Tuesday night. A CDC contractor who was tasked with screening passengers at LAX tested positive for the virus. More recently, California Governor Newsom has declared a state of emergency for the entire state of California. As of Wednesday afternoon, there were 53 cases of COVID-19. Newsom said in a statement, the state of California is deploying every level of government to help identify cases and slow the spread of this coronavirus. This emergency proclamation will help the state further prepare our communities and our healthcare system in the event it spreads more broadly. More than 8,000 people are currently being monitored in California. A New Hampshire hospital worker became the state's first case on Monday and was ordered to self-isolate. However, that patient who was confirmed to be infected defied those orders and instead attended an event that took place, I believe, in Vermont. The New Hampshire Department of Health and Human Services said the first patient, despite having been directed to self-isolate, attended an invitation-only private event on Friday. Healthcare workers have reached out to all of those attendees and have told them to follow the recommended 14-day isolation. New Jersey has also announced its first case. A patient who is in his 30s has been hospitalized since March 3rd. And in New York, 1,000 people have been told to self-quarantine following new cases that have popped up in Westchester. The U.S. military has also confirmed 2 cases of the virus found in relatives of troops in South Korea. At the same time, South Korea has declared what it is calling a special care zone around a second city hit by the virus. The seafood market in Wuhan, China, that was thought to be ground zero for the deadly outbreak of COVID-19 has reportedly been demolished 2 months after it was closed. 66% of patients that were suffering from the virus in Wuhan hospitals as of early January had been exposed to the market. However, there have been conflicting reports since then about the market's involvement in the outbreak. Australia has banned travelers from South Korea and instituted enhanced screenings of visitors from Italy in an attempt to contain the spread of the coronavirus, according to the Prime Minister. He also indicated that there would be a ban on travelers from China and Iran as well. According to India Today, at least 15 Italians have tested positive while visiting other countries. In Israel, around 100,000 people are currently in quarantine. During a press conference, Prime Minister Benjamin Netanyahu said, "We have to understand we are in the midst of a global epidemic, the most dangerous of these epidemics in the last 100 years. And Iraq has reported the country's first 2 confirmed cases, according to the BBC. Germany's health minister is now calling this a worldwide pandemic, as researchers have identified 2 different strains of the virus. One strain is reportedly less aggressive than the other. According to the study, 30% of the strains studied were the aggressive type, so 70% were less aggressive, which a lot of people are looking at as a good sign. Researchers say that the aggressive virus began to decrease in prevalence in early 2020. But unfortunately, China has reported that a 36-year-old recovered COVID-19 patient fell ill again 5 days after recovering and being discharged from the hospital. And then he died. It's unclear which strain of the virus he had, if it was the more aggressive or the least aggressive kind. Global pandemic buying continues. I know a lot of people probably have personal experience with this one. Panic buying across the country continues as people prepare for possible quarantine and shortages of food. On Wednesday, Australia's biggest supermarket chain announced a limit on the amount of toilet paper that could be purchased. Woolworths said to ensure more customers have access to the products, customers would be limited to only 4 packs of toilet paper per person. The chain has also moved hand sanitizers behind the counter and has placed a limit of 2 per person. Americans are sharing stories of finding empty store shelves, but online retailers are also feeling the stress of panic buying. Amazon Prime Now, Instacart, and Walmart have all been overwhelmed by the increase in orders and are expecting delivery delays. Social media users have reported dousing items they've ordered online in products like Lysol before opening them. Amidst the increase in buying, the World Health Organization has suggested that contaminated money may be spreading the virus because it remains on surfaces for days, and they suggested that people use contactless payment methods instead. This point is bringing up a lot of controversy. Some folks are concerned that this means the world may be headed more towards a cashless society, which that is definitely something to keep an eye on and to look into a bit more. Schools and offices are closing across the world. Italy's death toll has risen to 79, and the country has ordered all classrooms throughout the country to close until mid-March. Italy also plans to close theaters, as well as ban public events across the country. Almost 300 million students throughout the world are home from school this week as the virus spreads, and Greece is the latest country to close schools and universities, as well as cancel large public gatherings. Despite recording the highest number of cases and deaths in the United States, Washington officials have not yet ordered schools to close in the state. A King County health officer has acknowledged the need to keep our society functioning, our businesses functioning, and schools functioning. But he says that they will close if there's a confirmed case associated with that school. And earlier today, we learned that 37 schools in King County are now closed. Facebook has decided to close its Seattle office after a contractor was diagnosed with coronavirus. And that's the last update in here. Down at the bottom, you can click on the link to check out yesterday's update and yesterday's video just like this one. Make sure you keep an eye out for the next article summarizing the recent developments. Make sure you check out our COVID feed on Telegram. If you use Telegram, which I highly recommend, you can find it at COVID-19 report, and you can follow that. Or if you do not use Telegram, go to t.me/s/COVID-19 report. Well, thanks for watching this update video, and I will get back to sifting through the headlines and get to work on our next roundup article. Please remember to check out that article on themindunleashed.com and click on the links. Do digging for yourself. Don't just read the news that I'm putting in front of you. Ask questions and try to find those answers for yourself and come up to your own conclusions on this stuff. There is a lot of fear-mongering out there. There is a lot of mixed information and a lot of confusion. And feel free to reach out if you want to bring something to my attention or you have a question. Please don't hesitate to let me know.